I'm Zephyra, everyone. So for those of you who don't know me, I'm Zephyra Sharifa. I am Doc's assistant as far as apprenticeship. I am also assisting him with Shalom Health Institute in the classes and the courses, etc. So today we want to cover some surgical health with you. Okay, I'm going to do a first part of the presentation. Doc will continue with a part 2 because, you know, he's so esoteric. He has to go second because when he's finished, you gotta do your research after that. So I'm going to open it up and just go over some things that we should know. And if we don't know, we're going to learn today. So please have a journal, take notes. Usually when we have our courses and classes, you usually get worksheets. And even though it's not a class part of a course, of course, I still did a worksheet because that's what I'm used to, especially when I have to do a presentation. So let's talk a little bit about the anatomy, just to kind of pinpoint the information. So the cervix, if you know we're not really familiar with it, the cervix is a part of the female reproductive system. It is the part where it's the lower part of the uterus, that narrow part that leads from the uterus womb, right, which connects the main body of the uterus to the birth canal, acting as a gateway between them. And usually, you know, baby's got to come through. That's that path. That's that path into this outer world. So the cervix is made up of mostly connective tissues and muscles. Right, that's why you can squint, do them little exercises and stuff. It's actually divided into 2 main parts and a transformation zone. Now, there's the endocervix, which is the inner part of the cervix lining. The canal, it lines the canal leading to the uterus. So that's that part that goes up, right? And the ectocervix, which is also called exocervix. So, but that ectocervix is the outer part of the cervix, which projects into the vagina. You know, it's like lips, pouch, right? And it's lined with stratified, squamous, non-keratinized epithelium. I get it. You may not know what I'm saying now, but when we're finished, you'll be very familiar with what we're talking about. And the endocervical canal is that transformation zone. That's the zone where there's a lot going on within that zone. Because, yeah, there are 2 main types of cells that are in the cervix. There are glandular cells and there are squamous cells. There's a conversion period as well, and we'll talk about it a little later. So we'll talk about how it's converted from one to other. And it's a process that has to happen, and it's just naturally happening. But the cervix performs 2 main functions. It facilitates the passage of sperm into the uterine cavity. Now, the environment is maintained by a frequent shedding of the endometrium. That's the thick cervical mucus and a narrow external OS. Now, there's so many different synchronizing processes that's happening physiologically, where if certain things are not taking place, then that's where you're going to sense pain, maybe some discharge, if there's any kind of overgrowth of anything. And there are a lot of things we can do to prevent that. And we have to pay attention to signs and symptoms so that we can be proactive on getting things checked out before conditions get to a point where it's like at a different stage, right? Sometimes it's just more difficult to treat something when it's moved from one stage to another. Now, because the uterus is self-cleansing, there will be discharges, okay? However, we need to know the difference between what is considered normal and what is considered a potential problem, right? So the vagina has a whole microbiome of microorganisms that they're present because they have to protect this sterile region, okay? it's like our security guards down there. Anything come in that don't need to be there, they're going to be battling. And sometimes they are overrun by the invasion, right? Then, of course, you're going to start seeing a lot of signs. So now what's going to happen, bacteria growth is controlled and affected by many different factors, such as acid level. That's our pH levels. Okay. Now, I want you to pay attention to some things. When you're not, or let's just say when you have a certain lifestyle and you're eating a certain way, all those fried food, those canola oils and the soybean oils and the oils that are really not good for us and our process overall, when we're, alcohol, beer and all of these things, when you start eating even a lot of dairy, it throws off our pH levels, right? So when we have to be very cautious of what we're eating, because our cervix and our whole region down there depends on it. pH levels can be easily tipped and swayed, but you will know when your pH is off. I think for women, there are two ways to really know when your pH is thrown off. If you go sit on the toilet, even if you go to urinate and you smell an odor, that's one sign that the pH levels are off. And believe it or not, underarm odor. I personally don't even wear underarm deodorant. I don't have any odors because for so long I've learned how to keep my inner body clean. So if I smell my underarm at any point, and I mean, those are signs for me, I'm like, okay, got to balance my pH levels. So that's just another little note. If you notice your underarm, and people put on underarm deodorant and all it does is mask things. So try a day without underarm deodorant, and you're going to see if you can smell that and you haven't been out working and doing any kind of gardening and moving around, you can just smell it. That's another sign that the pH levels are off. Okay, so take notes of that. Also, let me see, hormones. When your hormones are thrown off, that's another thing. It's going to be a sign. You're going to have some kind of evidence that's going to present itself, okay? Antibiotics. When you may go to the OBGYN, you may have a BV or something, and they give you that metronidazole. Well, that kind of clears out everything. It doesn't matter if it's a good bacteria that you need or not. It's going to clear everything out. It's going to clear everything out. So what happens then, you may at that point have an overgrowth of candida. Because see, when the acidity is too high, you have a certain effect, and when it's too low, because a woman's vaginal area is already acidic, it's supposed to be, all right? But when it gets lower than that percentage, then that's when that candida overgrowth, you will see that as well. So when those antibiotics get in your body, it's going to affect something, whether it's metronidazole or whether it's an antibiotic you may be taking for something else, even if it doesn't have anything to do with the womb. All right. So we have to be careful of what we're using. Birth controls, believe it or not, birth controls have an effect on our vaginal health. Also, douching, you can't wash it away. If something, you feel something is not right, if there's an order, stop trying to wash it away, because it doesn't work. It doesn't work that way. You can't wash it away. Bacteria, believe it or not, bacteria has an odor. And if you try to wash it away for that moment, give it an hour or two, you'll smell it again. Right? So douching is another thing that rinses out what we need. It disrupts the whole microbiome, because we're washing away some bacteria that we actually need in that space. Believe this or not, diabetes, it has an effect on our vaginal and cervical health. So we have to maintain healthy eating habits, taking care of ourselves, trying to manage any kind of ailments that we have, because it's going to affect other areas, especially for women when, diabetes. We also have stress. Stress will throw anything off. Don't think you're just going to breathe and calm your mind and it's over. The body, it's a domino effect. So anything which upsets the balance of the vagina will increase the risk of infections, overgrowth of any of the normal bacteria and or by yeast, which is that candida. You may notice a change in the color or the amount or the odor. Thin, white, it might be a little sticky like that. That's kind of like normal, right? But when you see it gets to changing colors and it gets darker or that yellow or that greenish, anything that's not that clear, it's like a translucent white. If it's not that, pay attention to it. Start to document your dates as well. A white curd-like discharge that looks like cottage cheese is classic for a sign of candida, right? That's like a yeast. And if you end up, let's say, with a BV and a yeast at the same time, you might have the odor at that time. But a lot of times the candida doesn't have an odor when it's just by itself. But you will notice the thickness and the cheesiness of it. And we're talking like cottage cheese thick, right? Chunks. And there's also yellow, green, or gray discharge is usually a sign of trichomoniasis, we call it. That's the full word, but let's just say trick. And also bacteria vaginosis, BV. That's when you really know there's an issue. Bacteria vaginosis come with an unusual fishy odor. I wanted to make that clear. Anytime you smell anything like that, definitely something is going on. A dry, irritated vaginal lining may be a more prominent symptom of, they call it atrophic vaginitis. And you mostly see that in menopausal women. All of a sudden, a new vaginal discharge accompanied with a fever or any kind of abdomen pain or any kind of pain during intercourse may indicate a transmitted disease. We're talking more gonorrhea, chlamydia, and those type of infections, even though some people don't even have like a discharge. But you will know because there are going to be other signs. Some people have a burning sign. In addition, the pH levels of semen needs to be between 7.1 and 8. All right. And they're higher than the pH levels of the vagina, which should be about 3.8, 4.5, in between there. Now, during intercourse, our pH levels in the vagina, it rises in order to create a more alkaline environment to protect the sperm and encourage a fertilization. To get the best results, especially if you're trying to get pregnant or if you're trying to be fertile, then you have to know these things, right? So this can also encourage the growth of certain bacteria when it throws our pH off, even when we're doing intercourse. And because it's rising, there's a possibility that it is going to throw our pH levels off. And while this rise in pH is immensely helpful for conception, it does open us up to a risk of infections. Okay? A few recommendations, annual pap smears are recommended because they are a precautionary measure. Matter of fact, I don't know if any of you have been told this, but if you go to do an annual and you say to the doctor, I noticed a discharge, see, that's called an ill visit. An annual, they really don't want to see you if you're sick. You have to do a sick visit because that pap smear is only to test for cervical issues. So if any of you going for an annual and have to end up doing other things, check the bill. I know you don't see it if your insurance pay for it, but check it because you're going to have a couple charges on there. You might have 2 type of visits charges on there, okay? Because they have to do, the visits are for specific reasons. Now, a pap test along with a pelvic exam is important for a routine well care. Now, it can help determine any abnormal cells that can lead to cancer. Early detection is imperative. Also, the vagina needs to breathe, dearies. Needs to breathe. All right, so cotton is the best material for the underwear. It needs to breathe. Why? Because if it doesn't, it's going to absorb moisture. It is also naturally hyperallergenic. We're talking cotton. So that's the best type of material that we can use to help us out in our I say rites of passage, because as women, we always have to make sure we're maintaining health in these regions. So I hope that is just giving you a start to our presentation. Now, we getting ready for Doc, because he's getting ready to put it down. Have your pens and paper ready, dearies. Peace and love to you. Thank you for being here today.
Just wanted to share some love with the ladies. That was a good presentation by my assistant, Zephyra. I appreciate that energy, bringing in some feminine energy for the ladies on this particular subject, because it goes really, really deep, and a lot of us need to be aware. I had a couple of clients that were needing some assistance on cervical cancer. I was able to help many clients overcome HPV, which you guys just learned from Ms. Zephyra, that HPV is one of the causative agents to cervical cancer. Our environment load, as they say, our ecosystem, our bacteria load, our gut microbiota, our vaginal microbiota, all changes. It evolves. And I'm going to be sharing with you some reasons why we are, as ladies, are developing things like HPV. One of the clients that I had, she was introduced to the HPV vaccine back when she was 14 years old. And I'll turn this off for a second. She was introduced to the vaccine, and then by the time she turned about 32, she did another pap smear, and they found abnormal cells. And I just wanted to let you ladies know that this could be one of the introductions to cervical cancer. Even though they were stating and claiming that this was a way to prevent cervical cancer. Obviously, the strands that cause are being used to develop the vaccine. So I just wanted to throw that in there, because there are many different ways that people develop HPV and also can develop cervical cancer. So that was one of the main or the common ways that I've seen. Another way that ladies have developed cervical cancer or HPV is because they have been on birth control. I heard Ms. Zephyr mention that birth control could have been used, but I believe that when you use it over 5 years, you have an increased risk of developing HPV or abnormal cells. And that has a lot to do with what we call methylation. I am supposed to do a full class on methylation within my next semester, and I want to really share how we develop mutations within our DNA. And also there are certain breaks in our DNA strand that pretty much changes how we methylate. It changes our genome, and every one of us has to go through something called epigenetics. And I just want to let you guys know that we are evolving, and we definitely have to keep up and make our ecosystems balanced and healthy. So I'm going to focus mainly on cervical health. I'm glad Miss Zephyr was able to take care of the vaginal part, because that's something that I believe that needs to be feminine, something that I can't really speak on, but I have in the past. And but I do want to dedicate this particular section just on those who needed help with cervical cancer. There are going to be different impressions that the doctors are going to write up and tell you that there's a dysplasia, basically meaning that there is a proliferation or an abnormal amount of growth in these particular cervical cells. There is a anatomy that we need to be aware of. The internal cervical os and the external cervical os, along with the endocervix and the exocervix, they all have these particular cells that are supposed to convert and change into other healthier cells. But there is something that inhibits, stops that from happening when people develop abnormal cells. And that could be one of the common things. It could be the birth control. It could be the vaccine. It also could be something called trichomonias. Trichomoniasis or trichomonads, however you want to say it, but these are parasites. And a lot of people don't know that this is a parasite to human or a parasite to parasite type of transmission. And it does not have to be sexually transmitted. It could be skin or genital, just touching a towel or on a toilet, or those type of transmissions really happen. And that's how a lot of us are being contaminated with certain things. So our cleanliness really is important. But if it is sexually transmitted, we can use certain antibiotics. I don't like to call them antibiotics anymore because I find that I'm needing to have to use different methods that can really truly eradicate certain parasites. And I like to call them anti-parasiticals. All right, so I have ways and methods, and also the ability to order metronidazole or tinidazole. Those anti-parasiticals are really good for eradicating trichomonads. And you may see this called trichomoniasis vaginalis. And so that means it's located within the microbiota of the vaginal canal. And it's also right there where the cervix can start to develop its leukorrhea. These are leukocytes that are filled with different other microbiota, which we would call bacteria. You may find that a yeast infection or the candida that develops from these leukocytes may be more abundant, I would say. As far as how trichomonas, this is one of the causative agents of HPV. And 50% of the women don't even experience any type of symptoms. But if you do have symptoms, you'll notice that there is a fishy odor that has developed. And it also can contribute to what they call pelvic inflammatory disease. In men, a lot of the times this can be wedged into the prostate and cause prostatitis, which is an enlargement of the prostate, or hyperplasia. And it can live there dormant for a long time. Men don't even have any symptoms, so I'm always encouraging the men to make sure that they take some type of tinidazole once a year would be fine, because these things, you should be taking them with a probiotic if you want to maintain a healthy ecosystem. So it's a good time to think about that. I'll probably leave you guys a link where you can possibly order these things on your own instead of going to a doctor looking for these specifics being a part of their system. But you can order these things, especially these pharmaceuticals in India, Cambodia. You can order them in Canada, and I'll leave you guys some links in the class, in the group. All right. But these parasites, they like to go through what they call the endoplastic reticulum. This is a part of any type of squamous cell, epithelial cell. You might have heard Ms. Zephyr say something about squamous cells. 80 to 95% of these squamous cells are located in the endocervix section of the vaginal canal. So you need to know that most of the cancers are mostly squamous cell carcinomas. And that's about 80% of the women will have squamous cell carcinomas. And the other 5% would be something called adenocarcinomas. And that happens in the endocervix as well. All right. But HPV is a non-developed double-stranded DNA virus. And what we call trichomoniads is more of an RNA. So it's more like a messenger or a way to help things basically transform. And they make these things called extracellular vesicles. And you may see on your lab results that there is something called E6 or E7, and they inhibit tumor suppressor gene P53. And this is more of the way to stop the cells becoming cancerous. And if this is inhibited, then it's not working properly. So these particular vesicles are what they would call nanometers of exosomes. I don't like to call them viruses at all because they basically come from a parasite. And they basically inhibit this transmission and stops your suppressor gene from making it grow. All right, so these are ways that they become pathogenic. They become oncogenic, cancerous. But this is all diffusing, or what they call endocytosis. It diffuses through the cervix, and it is able to create cancerous cells there. All right, so we're supposed to have checkpoints. We're supposed to have checkpoints on our way that we divide these different cells. Instead of them mutating, there is something going on in our methylation, which is a folate deficiency. I will go ahead and tell the ladies now that in order to develop HPV, these extracellular vesicles, which are coming from the trichomonads, are feeding off of your folate. Okay. Folate is very important when it comes to DNA cell division. It's very important to DNA metabolism. And if these things are disrupted, you start to have a folate deficiency, and they make breaks inside of our DNA. They make little detachments in our DNA. But if we could get rid of the parasite, which is we're using metronidazole and we're using tenelidzole to get rid of the parasite, and then we can start working on our folate. So since we already know that it is a folate deficiency, a lot of the ladies that are having folate deficiencies also have anemia. They also have low oxygen. So cancer develops in a low oxygen environment because we're not methylating. There's DNA mutations, breaks inside of our DNA, and we need that folate. Okay, so we use methylfolate because these are methylation processes, and the methylfolate needs to be between 400 and 1,000 micrograms per day, and it doesn't need to be every day. Okay, we'll be getting a lot of folate from flavonoids. Flavonoids are like your fruits and vegetables. You'll notice that your dark green leafy vegetables have a high amount of the folate. You also notice that your nuts and seeds will have some folate as well. Also, beans will have folate. You do need to make sure that you're having plenty of antioxidants if you ever develop stage 1 or stage 2 cervical cancer. You're going to need your antioxidants like CoQ10 because they build up on epithelial cells. Epithelial cells are the lining of any hollow part of your body. Epithelial cells are also your skin cells. So your vulva could also develop what they call lesions or genital warts from an HPV or from cervical cancer. So those epithelial cells need to be protected. All right, so have plenty of antioxidants. CoQ10 is really good for that. Selenium is an antioxidant. You need your carotenoids, so all of your beta carotene, things like carrots. Beta carotene would be found in green leafy vegetables as well. So you do not need to be eating foods that are going to contribute to the cancer. All right, so those foods are like your hydrogenated oils coming from French fries, your burgers, your breads, your Even though certain grains have beta glucans, and I'm going to talk about beta glucans because we need those beta glucans for a certain reason. But grains are going to turn into sugar, and the sugar is going to increase insulin, and insulin can drive cancer because they also have plenty of glucose receptors right there on cancer cells because they like to feed on sugar. So we don't want to increase insulin when we're doing this. So meat is no good. Don't eat any grains, and I will stay away from those hydrogenated oils. I know for my client who did chemotherapy, I made sure that she knows something about Pectazol. I want you guys to write that down. It's called Pectazol, Pectasol. It is a high antioxidant, and it prevents metastasis. Okay, I'm giving you guys this information because you guys need to. I don't always sell everything, and also you can find these things online if you know about them. So this is going to support your immune health. You can use a product called Wholly Immune by Allergy Research. It's going to support your detoxification. If you don't have a way for these abnormal cells to detox, then they're going to continue to proliferate. All right. So not only will you have to fix the folate deficiency, but you also have to find a way to keep these things detoxed. And one of the ways that I found is that if you use a compound called indole 3-carbinol, you can use that in about 400 milligrams to basically treat the dysplasia, the proliferation of those squamous cells. We need to have more quercetin. Quercetin is like a flavonoid found in pectin of the orange, maybe of the apple. The pectin of these have very strong antioxidants in it. Beta carotene is there, and quercetin is really good. The mushrooms have something called mycelium. The mycelium found in maitake mushroom, agaricus blase, shiitake mushroom, reishi mushrooms, all have a way to suppress basically angiogenesis. Anti-angiogenesis is basically the stopping or the inhibiting of new blood vessels. If we're using beta carotene, folate, all these different methods, the body is going to self-cleanse. We got to remain and get that balance back again. Of course, I have teas right here that we use. Cat's claw is one of my number one things that we use to support DNA repair and also have a healthy cell division. And it's one of those ones that can help you change over those mutations. Chaparral leaf. Chaparral leaf should be used to rebuild your red blood cells and your white blood cells. It is a cancer and virus fighter, powerful blood cleanser. This is one of the ways that I help build up leukocytes, and which is basically your eosinophils, your basophils. They get really affected when it comes to this. Oregano. Oregano is going to be our antifungal, antibacterial, antioxidant, antiviral. It treats candida as well. So I think this should be definitely a part of a tea that you should drink on a daily basis. Cleavers is going to act as a purifier and detoxifier for your lymphatics and as well as a diuretic. So cleavers herb should be used as getting rid of all of the material that's there. Another powerful blood cleanser, and for ladies that are going through anemia, all of these things will be happening if you have a folate deficiency, or you can have a what they call type S protein deficiency, which automatically makes your methylation slow. You can use yellow dock. Yellow dock will help treat any type of bacterial infection, but also help treat the anemia. Now, the secret in using all these different herbs is not just using water. Use green tea. Green tea will help speed up the recovery. Okay, it's going to help detox faster. Whether you use one of the other methods that my client is using, she's using Dr. Case or SEXT method. This is one of the really good ones for cancer. You should also use green tea with this as well. So if you're going to make your green tea first and then you make this second, add those herbs to it. That'll be a good way to do. The next things that I would use is vitamin D and vitamin A. All of our epithelial cells need vitamin A. And when it comes to building up our white blood cells, you're going to need vitamin A. Skin cells, mucosal membrane. Vitamin A is just one of the things you're going to definitely need for cancer, period. Vitamin D is also an immune regulator and modulator. But some people may not be absorbing their vitamin D very well. So in order to get that absorbed very well, we got to make sure that their gut doesn't have any leaks, that their tight junctions are close together, as well as making sure that they have good bile flow coming from their gallbladder. And that way they can absorb their vitamin D, all their fat soluble vitamins correctly. So, that was a lot. You guys have the ability to go back and watch this video as much as possible. We talked a whole lot about cervical cancer, and with the methods that I've just shared with you guys, the body has a way to self-cleanse. We don't need these invasive surgeries. I think that we definitely need the anti-parasiticals to get rid of the trichomoniads, and also use the iodine, use the folate, use the selenium to get rid of the HPV. And as far as the abnormal cell growth, we got to maintain a healthy balance in our microbiome. So making sure that you take some type of probiotics, because the same microbiota that's in the vaginal canal is also the same microbiota that is inside of your gut, as well as the nasal cavity. So when things are balanced, these things don't become disrupted. So I appreciate you guys listening. If I forgot anything that I needed to share, I will be putting that inside the group. But I do want to thank you guys for attending this class with me and Zephyr. And let us know what you think and let us know what you've learned. And I will be in the group. I'll see you guys next month with our next month class. Give thanks. Blessings.